At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome. Dr. Tom here, and we got another great program for you on Dr. Tom Roselle Live, one that's very special in a lot of different ways. You know that we've been doing a series on head trauma and concussion and so forth, and coming up this coming Wednesday evening, we're going to be doing a program in-house at the Roselle Center for Healing in Fairfax, 6 p.m., and you're welcome to join us. You need to go to drtomroselle.com or rosellecare.com and register for it. And remember, if you can't make it, that's cool, but let us know so we have room for somebody else. And I promise you, this is going to be an extraordinarily good program. We're going to continue the process, and this week I have a friend, a brother, someone who I have more respect than virtually anybody that I know in the professions. He was with the Kansas City Chiefs for 12 years. He is a chiropractor, applied kinesiologist, above most in the planet. And having said that, he just came out with a book. It's called Doc, When Can My Kid Play? But we're going to kind of segue that into concussions generally across the board, because he is the expert, and we're going to kind of do a show and tell when we go to the live stream. So don't forget to join me on the live stream, Ageless Health with Dr. Tom Roselle. How you do that is you go to drtomroselle.com. That's drtomroselle.com. Click on the banner or go into one of your favorite social medias, because we're on all of them, and let us know, what you think. And you can also talk to us by just going into the chat box. Having said that, let me introduce this amazing human being, Dr. Evan Mladenoff from Kansas City. Hey, brother, welcome to the program.
Good morning. Thanks for having me on. This is so awesome. And I'm really jacked because October 1st, they finally released my book. And in a couple of days, it should be on Amazon. And it was a very, very long year trying to get this thing fully published, but we're there. We made it.
And we're going to have it on our website as well. We're going to have it on Dr. Tom Roselle website, and we'll have it on Roselle Care website. And we'll also make it available through all of our social media sites. So you'll be able to get it in multi-dimensions as well. So we'll keep playing that tune for you, meaning buy this book. It's called Doc, When Can My Kid Play? By Dr. Evan Mladenoff. Evan, let's get into a little bit of this is a short segment, got about 25 minutes, and we go into the live stream. So let's talk about how easily people, children, if you will, we can start with that, move it into adults and older people. How easily does a concussive pattern occur that we may not suspect that somebody has one, and we really need to be looking for it, and we let them go back? I'm going to let you run with it. I'm going to ask you some questions as we go through.
Okay, the biggest thing is, I always say, if in doubt, go to ER. If you have any loss of consciousness, even for a second, if your symptoms are getting worse after head trauma, like nausea, vomiting, trouble sleeping, trouble staying awake, or you can't wake up, if in doubt, go to ER. Now, having said that, when you go to ER, the purpose of ER is to make sure that there's no life-threatening situation going on. Is there any fracture? Is there any internal bleeding? Is there anything ominous going to happen to you? And then now we have a bigger problem, and that is most ERs, they'll go in and there'll be a resident there, and he'll be looking at his phone and be reading questions off of an app to determine an algorithm. Should you get a CT scan, or what should you get? They don't even look at the patient. They don't touch the patient. They just determine, okay, you're good. Here's some drugs, go. And we literally had this happen about a month ago with a mom. She called and said, my child fell off the it looks like a little igloo, the monkey bars, but it looks like an igloo. 8-year-old girl fell off that and landed, hit her head, was unconscious for an unknown length of time. So mom calls me, she's got bad headaches. What should I do? I said, go to ER. She says, no, they're stupid there. I don't want to go. I said, no, go to ER. The problem is they were 3 hours away from us in the city they live in. She calls a couple hours later and relates that exact story. Just said he didn't even look at her, didn't even touch her, just read his phone, said, okay, you don't need a CT scan, you don't need an MRI. Here's some drugs, go home. So we have that problem with ER. But if in doubt, I still say go to ER. Having said that, whenever there's a concussion, whenever there is head trauma, and your head doesn't have to hit anything for there to be a concussion. When you get a chance, you should do a YouTube search of Scott Stevens, Eric Lindros. This was two famous hockey players, and the Scott Stevens hit Eric Lindros, who was a big man, 6'4", 245, and it's a shoulder-to-shoulder impact. And you see Eric Lindros's head being whipped back and forth. He is unconscious before he hits the ice. So your head doesn't have to hit anything. 5 injuries occur when you have head trauma. You have a neck injury, you have a metabolic cascade, certain chemicals change in your brain. Then you have a pituitary stalk injury. You have neuroinflammation, which is another kind of chemical trauma. And then you have a vestibular injury. If all 5 areas are not examined, then stuff goes under the radar. You can be symptom free, but you can still have problems in any of those 5 areas. And that, of course, is the problem. Not too many people examine all 5 of those areas where injury to some level will occur. Now, the problem is some people will feel symptoms in the vestibular system. They'll have balance problems. They'll feel dizzy. They may feel nauseous. Some people will have problems with the neck. The 2 important things: if you go to ER after concussion and you have neck pain and you have a headache, or either one of those, the amount of time it's going to take to get you better now triples.
Evan, let me ask you a question as we go on, so we can, coming from the expert's mouth, what is the definition of a concussive pattern relative to physiological? That's what's happening. Is it a bleed? Is it a swelling? Is it just an impact that interrupts the transmission of neurological signaling in the brain? How would you define it, particularly when somebody's they get hit in the head, but they say, yeah, I'm okay. In the old days, suck it up, you'll be fine in the morning. What are we missing?
That is a great question. It is an ongoing debate in the medical community and the research community. Do we call it a concussion? Do we call it a mild traumatic brain injury? And there's this volley back and forth, and we're getting stuck on the words. So the CDC has an official statement. You can go, you search CDC concussion statement. The latest Amsterdam International Sports Concussion Symposium has another definition. Here's the bottom line. When your head, picture this, a volleyball on top of a stick. So that's your brain on top of your neck. When your head gets violently moved, so that ball gets violently moved and it doesn't have to hit anything on top of that stick, that's where those 5 injuries occur. There doesn't have to be any internal bleeding or anything like that. So the violent movement of the brain inside the bones of the head is what happens. What do we call that? Some people call it a concussion. Some people call it mild traumatic brain injury. So don't get caught up in the names. If your head is violently whipped without hitting anything, you will have some type of involvement of one of those 5 areas. If your head hits something, it probably is magnified, and you will have some of those 5 areas involved in the injury. So that's what I like to tell patients, is there are 5 areas that have to be examined. So a year after the concussion, they still have symptoms. Why do they still have symptoms? It's because they didn't examine all 5 areas that get injured. And part of that is they might not have had any symptoms.
So you're interrupting the neurotransmitter, pathways in the brain, and that can obviously, by itself, can cause all kinds of aberration. But you have a chapter in your book, and again, your book, Doc, When Can My Kid Play? But I think that has a direct impact to all of us. When can I go back to work? When can I function the way that I need to function? When is my memory going to come back? When do I stop skipping thought processes? You and I both of us went through an injury pattern, you on a bike and me on close contact with the floor. And we're trying to move through those things, and because of the things we know, we've gotten back. But you wrote an interesting chapter in your book. If you shake it, you break it. Does it have to be a direct blow impact that's going to cause all these things? Can it be a torsion spinning, or is it just an oscillation back and forth?
Yes, yes, yes. To all those. Even if you were a football hit straight on, nose to nose on the helmet, there's still torsion of the brain inside the bones of the head. Because your brain is like jello. It's very soft. It's very pliable. Then you got a layer of liquid around it. And then you've got like a trampoline that kind of holds it in place. Then you got some more liquid. Then you got the bones. So there's lots of room in there, relatively speaking, for the brain to slosh around. So if you move your head too quickly, even if you're driving right now, don't do this when you're driving, please. If you turn your head quickly because you hear sounds and you think there might be an accident, your brain gets sloshed around a little bit when you turn your head quickly. The problem is when that's violent and the inside of your brain hits the bones on the inside of your brain and the head, and then you get the problems of the neuroinflammation, the stretching of the nerves, all those other things that can happen. So the best way to describe this is the first written article on this was done actually back in 1928 in the Journal of the American Medical Association. They followed 23 boxers. Now, boxing is a curious sport because the name of the game is to hit the other guy's head intentionally. The more you hit his head, the higher the likelihood you're going to win. And they followed these 23 guys, and the end conclusion is at that time, they use the terms, he's punch drunk, he's in asylum, he can't walk, he can't talk, right? And fast forward, now we know that that's something called CTE, chronic traumatic encephalopathy. One of the things that one of my favorite athletes of all time is Muhammad Ali. And if you sequentially look at some of the pictures of him as a young man at the Rome Olympics, this was a vibrant stud of a young man. Fast forward a couple of decades, he float like a butterfly, sting like a bee. He is now retiring, and he's not so quick anymore. Then at the Atlanta Olympics, he lights the last guy to light the torch, and he's holding up the torch, and he's shaking like a leaf. Fast forward to the London Olympics, where he was named the Olympian of the century. His wife had to carry him onto the track so he could get honored because of the Parkinson's. It was so bad. So boxing gives us that unique window of what happens to the brain when it is intentionally hit. All those things can happen even if your brain doesn't hit anything.
For our listeners, Evan, let me ask you a question. And this, again, we've been talking and touching on concussive patterns and brain trauma over the last several weeks on the radio program, everything from hormonal dysfunction that can cause and the disruption of the signaling all the way through the vagus nerve and how it affects the heart and the like. So my question is this: you see the progression onset, which we've seen repetitively with Parkinson's, and even with kids, where they begin to go into a spastic gait pattern, which we've seen with some traumatic patterns, or conversely, just the inability to do what they were able to do. I want to get into this into the live stream with you, and I want to get into your examination and diagnostic patterns. But simply this, is this reversible?
Give me a little more information. I will quantitatively.
So you get somebody like
Muhammad. Yes.
So Muhammad Ali, if we had caught him early on, I had the pleasure of meeting him when I was an intern in Chicago, and he came in with his entourage, and so a hell of a guy, unbelievable. The term, sting like a bee and float like a butterfly. The guy was amazing. But if you had gotten him when he first started showing signs of the Parkinsonian pattern, could that have been stopped? Could it have been reversed?
high probability to both those. And we have a current live example right now. If you look at Joe Namath, and of course, he's doing lots of TV commercials and he's on a lot of the football programs. Well, this man did at one time over 100 hyperbaric oxygen therapy treatments. And if we parallel to that with Brett Favre, that was just announced that he now has been diagnosed with Parkinson's. And if you look at those two men that are, obviously 20 years apart in age, but Brett Favre missed the window of possibly being able to reverse this. He was involved in a drug study. So he went down the path of traditional Western medicine to deal with a concussion. And part of that is the drug-based approach. Well, if he didn't have all 5 areas of what I termed the concussionology matrix, then he's still going to have problems. You listen to his speech, it's already off. And he's just sitting there. And compare that to Joe Namath, who is clear. Now he has some hearing problems, which may be from the concussion, it may be aging problem, it may be kidney problems. As we know, there are other issues as we age that he might not have addressed. But from the trauma standpoint of playing quarterback in the NFL, those two gentlemen are on parallel pathways. Joe Namath has done something, and I've never met the man, but I know instinctively that he's done a tremendous amount of hyperbaric oxygen chamber, which to me signifies, okay, he might be doing additional alternative non-drug-based therapies that are helping him. Brett Favre went down the drug path, even sponsoring that drug study. And we can see the two athletes in their senior years quite different.
My guest today on Dr. Tom Roselle Live is Dr. Evan Mladenoff from Kansas City. This guy has an insight to concussive patterns, probably more intimately than most people will ever have. He was a doc for the Kansas City Chiefs for 12 years, an applied kinesiologist, chiropractor extraordinaire. He's just came out with his new book, Doc, When Can My Kid Play? And you can find that on multiple platforms. You're going to be able to find it on Dr. Tom Roselle Live, Roselle Care. And join us when we go to the live stream program, Ageless Health with Dr. Tom Roselle. Dr. Mladenoff will continue as my guest, and we're going to do you'll be able to see him and an amazing background that he has with more NFL shirts than you can possibly think about. But when it comes to the introspective, what I'm going to talk about when we get to the live streams, I'm going to ask him how these things can be monitored. And many of you have heard something, the term called heart rate variability. We're going to tie that into concussive patterns and how you can monitor. A lot of you gone out and bought these crazy, Apple watches, and you're monitoring ongoing. But we're gonna talk to the expert on those and see if they do you any good. But more importantly, what can be done. And Evan, I'm going to ask you this question as we lead into the live stream in about 5 minutes. You mentioned, and what happened to you happened to me, and we kind of, challenged our vestibular areas and our cerebellar areas. Can the swelling that occurs, if you will, to the vagus, the swelling that occurs to the vestibular area of the brain, if you catch it early enough, because that swelling within 72 hours goes into an adhesive pattern, it starts developing scar tissue. How quickly do you have to get to it to stop it so it doesn't progress over time? And what modalities, we'll get into it more in depth, what modalities would you have at your disposal to be able to handle that?
Sooner is better than later. But I'm going to add one more thing to that thought process, and that is when we're done with the show today, wherever you're going next, how are you going to get there? So Dr. Tom, I assume you said you're going to see a patient. How are you going to get there?
Get in the car and drive down Route 66 and going.
Okay, hold on. Shouldn't you take off your headset? Shouldn't you stand up? Shouldn't you walk to the door? Shouldn't you open the door? Shouldn't you walk out of the office, lock the office? Shouldn't you get on the elevator to go down? Right? There's a whole bunch of other stuff that you don't think about. They are automatic. They are subconscious. But you're saying, I'm going to get in a car and go. Well, you could probably start your car from there because I know you got a nice new car, right? With that remote fob, you can still start the car from there, but you still have to stand up. You still have to go out of the clinic. You still have to get on you still have to do those unconscious steps. The same is true with any condition, but especially with a concussion. If you do not examine and treat the patient in the neurological sequence of things that must be corrected, they're only going to get a little bit better or partially better. So sequence does matter. And then obviously the sooner, the better. So for example, if step number 13, 17, 24, and 94 are not working properly, yes, we want the patient to be symptom-free, but they might not have any change in symptoms until we fix those first 3 neurological problems that have occurred as a result of the trauma. Sequence matters, and then time matters also.
So you get somebody that comes to see you, and a young athlete, college level kid, high school and so forth, and they've had trauma, they've had a blow, and I want all of us to kind of relate to the stuff we do. We have a couple minutes. This kid got hurt last week, and he got his bell rung, and they told him, yeah, you got a concussion, but you'll be okay in a couple of days. And but he's gotten headaches, and he's noticed that his vision, he can't focus, he can't concentrate, he's a little nauseous and so forth. This is week post injury. What steps do you take before you say you can go back to go to practice? You got about a minute, brother, and then we got to go to the live stream.
Okay, we don't have enough time if you give me the whole hour. But when we go to the live stream, and the literature confirms this, there are several tests that people can do at home that will determine how long it's going to take to get better. And the simple one is called convergence insufficiency. Can your eyes focus on something 6 inches away from your nose? And if your eyes cannot focus 6 inches away from your nose, or one eye starts to deviate, it's going to take a lot longer for you to get better.
Okay, Evan, hold the thought. We're going to go to the live stream in just a minute. This is a program I could talk to this man for now to eternity, and I take every opportunity I can. Matter of fact, we've known each other for over 45 years. But having said that, this is the expert. We're going to continue the process. Doc, when can my kid play? Join us on Ageless Health live stream immediately after this. Go to drtomrosell.com. Remember, we continue to do this for you, to give you the information you should, but more importantly and more specifically, I love you all. Join us, Ageless Health live stream right now. We'll meet you there.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.